Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. Today, we're honored to host Roger Jansen, Chief Innovation and Digital Health Officer at Michigan State University Healthcare. Roger, it's great to have you with us today.
Thanks for having me, Liat.
So Roger, before we dive into topics today, such as digital innovation at MSU, AI in healthcare, and all that good stuff, give us some context around Michigan State.
Yeah, so Michigan State University, we're a lot like other health systems, I guess, who are associated with universities. We have a full gamut of specialties and general practitioners. I think we employ around 750 physicians at the moment, about 3,500 total clinicians. We're also tied into our medical schools. We have a DO as well as an MD, and into our Bachelor of Science in Nursing program. We're actually the third largest medical school in the United States, and we're one of the top 10 NIH-funded schools as well. So a lot of what we do is practice, but being a university and being a very research-focused university, we want to make sure that we tie those two themes together.
That definitely helps you be a trailblazer in the digital healthcare space. And as far as your role as CIO and CDO at MSU, what does a day in the life look like?
It's pretty exciting, actually. One of the things I'm a former clinician and used to practice. And when I was practicing, I always kind of wondered, is there other ways to do this? And then how do you do it? And so moving it more into the administrative side has allowed me to take a look at that. And typical day for me is trying to figure out how can we, in all sincerity, a lot of people say this, we actually mean it. How do we create more preventative care and make sure people don't move from a pre-diagnosed stage to a fully blown diagnostic condition? And how do we actually leverage innovation and technology, not just from a computer software app perspective, but from a holistic perspective around social determinants, food, nutrition, social support, financial support. How do we look at those things and consider them innovation that can change people's health outcomes? And so that allows us to take really a more broad look at the way we think health is determined. As we all have the same amount of minutes in each year, but we only spend about 12 minutes with a clinician. So most of our health and our well-being is determined outside of what a healthcare system does. And we're really focused on how do we play a role in that space.
Amazing. I love that preventative approach. What are some projects you're working on that are helping push that along, or a project that you're very excited about now?
We're working on a number of things. I think one of the things we're trying to do is understand our populations better. So how do we actually stratify people into risk categories appropriately instead of having somebody come in for, let's say, the annual physical and never seeing them again? How do we actually understand what stratification do they fit and how often do we need to see them? What other devices we need to send home with them? How do we partner with where they live, work, play, whether that's at church or it's the YMCA or it's at the grocery store, in a fashion that allows us to really help them look at their health and wellness differently? And so one of the projects we launched, and we've recently just gotten some research data back on, is with a company called Higi, who has kind of an omni-channel platform. And we really see them as providing kind of an extension of the healthcare services out into the environment and into the home. And so we've been able to work with them on everything from food coupons and rides to appointments and social support networks to remote patient monitoring, glucose measurements, those types of things, primary care visits. And what it's really allowed us to do is to truly cut out that gap between a visit and an interaction. And also it's allowed us to monitor people of when they may need to actually interact with us more. And we always say timing's everything, but in healthcare, timing really hasn't been focused on. It's only been focused on when things go wrong. And so our goal is to focus on it before things go wrong and make sure that we don't move into those conditions where it's going to be more expensive, more costly, and frankly, potentially more fatal. And so we need to take care of people before that incident, versus after it. And I think that's where we're really trying to make our mark. And I really think we're trying to make a difference between calling things health systems and medical systems. I think the United States has a very expensive medical system and a very poorly funded health system. And I think those are very important distinctions that we need to begin to make.
Well, I'll be picking your brain more later on why you think the U.S. health system is failing, because we know you have a pretty interesting opinion about all that, but we'll get to that. When you speak about Higi and this ubiquitous kind of escorting the patient throughout life and not just being that final stop, how are you seeing the patient's adoption of this new technology? What are you hearing from them that's guiding some of your thinking today?
Change any behavior, as simple as maybe taking a drink of water before they have a cup of coffee is actually a really difficult task, right? We're kind of creatures of habit. What we've been able to do is try to find a way to bring this to them in what I would say is a puzzle piece that fits into the existing puzzles that they're playing every single day. And to do that, we try to make it as simple, and they don't have to think about it at all, right? So it could be as simple as, hey, what we're going to do is we're going to incentivize you by giving you a $25 coupon to come on in and take your blood pressure or, your weight or whatever it may be. And you're already going to the store. Why don't you stop at one of the Higi kiosks and do that while you're there, and you'll get that coupon immediately. The other things that we've been able to do, we've been able to build it into routines and social platforms. So we can have a care management team work with them and just say, we're going to schedule a regular call. Here's when it is. And so they know when they need to do that and when it needs to be a part of what they're getting done. But what we've seen happen is people feel like they're actually being cared for and listened to instead of told and diagnosed, right? And I think we've lost a lot of the humanity in healthcare or in medical care, as I think it's become. And as a result, we're kind of bringing that patient relationship and focus on them and their well-being, not just their diagnosed condition, back to them. And I think it's through this sense of we're together on this. There's mutual accountability. There's mutual communication and trust and transparency. And by the way, we're here for your well-being, and we want to know what motivates you to do this. It's not a home run all the time. I would say that we have seen our net promoter scores go up very significantly since we've implemented this, and our patient satisfaction has just, for those who are on it, has gone from, I would say, average to well above national top quartile. And so I know that we're doing some things right. I'd also say it's probably a function of the person. Some people are willing and open to do this, and others are more reticent and conservative, and I don't want you to do any more than is necessary. So I don't want to put all the credit on us. There might be some selection bias in this in terms of who wants to be on the program and who doesn't, but we've been pretty happy with the results.
Wow, that's amazing. As digital as your scope seems to be, it also has a lot of empathy weaved in throughout these digital projects that you're working on. So it's kind of that interesting paradox coming alive.
If we think digital is just taking what we do and putting some, code behind it, I think that it's only going to be worse than what we've actually put into the market now. It needs to do more than just make what we do become a digital capability. It needs to offer some value above and beyond that. And digital, in my opinion, should allow us to spend more time on the human side, not less. And I think that's really where we want to make sure we're putting our approach.
I do want to backtrack. You mentioned the success that you had achieved in Net Promoter Score and all that. What are some factors that you can advise for other fellow CIOs and chief digital officers that helped you reach that success that they should consider implementing in their organizations?
Well, I think one of the things is, having been on the practice side before, you need to let people see that this isn't challenging your intelligence, your professionalism, and your capabilities, right? And I think there's some threat for some people when they think that you're going to enter a digital technology in. And, a lot of the people who are in practice have often been the smartest person from a grade perspective, at least in the room, and have always prided themselves on having the answers and being the problem solvers. And when you start saying we're going to begin to default that to some technology here, there's a bit of, whether it's, apparent or not, there's some resistance to that. And so I think you need to let them understand how this is a tool in their kit to do what they want better. No different than the stethoscope or the blood pressure cuff or the scale. This is another tool that you're supposed to use to not replace you, but to augment and enhance what you can do. And I think that's often missed. We throw these things in as this is going to be the solution for diabetes, and this is COPD, and go on the list. And unfortunately, what that does is it negates all the clinical intuition, training, human person component of the relationship. So my advice is remember that you're not implementing digital solutions to be the tire pressure sensor in your car. You implement these with people who have families and who have egos and who are sensitive to certain political and emotional and societal factors, and who may be insecure by some of these things and understand it. I also think you need to weave a story of what happens if we don't do this, and what happens if we do, and which one do we really want to be on the side of. So I don't believe in pounding things through. I believe that if you do that, you're going to get exactly what you wanted, compliance versus commitment. And I think we want to get people who are committed to these types of things versus just saying, I'll do it because I have to. And so my advice, again, I think it's going to sound really, really hokey, but you need to be sensitive to people's emotions in these types of transitions. It is crazy as we talk about digital. People make decisions based upon emotions. Just is what it is. And that's okay. But we have to remember that.
There's no way around that. We're still human nature. So
Yeah.
You are actually pointing at internal processes where you're trying to push along a digital project and get some pushback, as well as challenges, patient-facing challenges, external. So this brings me back to wanting to pick your brain on what feedback you're getting internally from clinicians when you're trying to push along digital projects. What is some of your advice there?
Yep.
And I'd like to know, one or two challenges that you face in your role and how you kind of found a way to tackle those.
Yeah, sure. So I'm going to go back to Higi because that's the one that we spent the most time on and is most recent, maybe not most recent, but most baked, if you will. We had a lot of pushback at the beginning. So we held some meetings with our clinicians. We did the pony show and went out and talked to people. I have been shocked at how well it's gone. To be completely blunt, our clinicians have embraced it. They brought to us ideas of how it can be implemented even more robustly. And they have probably championed it in a way that I have not seen before. And I've implemented a number of things clinically through my career. And this is probably the one that has how the heck was this different than those? Because it was so easy to implement and get people bought in. So when we backward engineer that and we try to find out what we did differently, I think there's probably two things that we may have done differently than before. Is one, we made it a part of them having a chance to ask questions and give feedback before we made any decisions. So they were a part of the vision creation versus recipients of the vision that was created. And I think that was a really important component of this. The second thing is we found champions internally who were already wanting to work with technologies like this, who had some results that they could share. And so they could see and show to other clinicians that there is some outcomes that will improve ultimately patient care and the health and well-being of the people we take care of. I think everybody who's in this field, sometimes we get caught up in the titles or, I think a lot of health system administrators are caught up in the compensation that they make. And I think we need to get back to what this whole profession was initially about, which was how do we help take care of our fellow person and how do we help them live better lives? And I think that's really innate in everything that we try to implement right now. That ultimately it's about helping people help others. And that's what these tools are about, is helping our clinicians help the people they take care of. It's not about competing with your knowledge or competing with your time. It's about, this is going to help you do a better job. And I think that's how we've had some success. The second part of your question is where we had some struggles. The struggles are really pretty magnificent in terms of there's only so much anybody can do in a day. And so everyone's busy. Everyone has limitations on the hours. And there are no lack of digital health solutions in the marketplace. The problem with those digital health solutions, at least in my opinion, is that they are very, very specific And when you're so specific and specialized, the ability to implement that and then bring in 20 other specific and specialized solutions means you're creating a connect the dots type of picture versus a Monet. And it becomes very hectic and very rigid versus naturally flowing and beautiful and has curvature and other things to it that you simply can't get when you're trying to put a bunch of things together. So I think we need to realize that one-off solutions and the VCs and others who continue to invest in them can only get so much traction in a world where the human body is a system, and health and well-being in medical care is a system. And we need to find a way to integrate those things. And right now, there's not a great solution to that. And I think that's our biggest trouble. So if I have the next great solution, now I've got to hook that up to my EMR. Now I've got to train my tech on it. Now I've got to get my nurses on it, my MAs on it, my PAs on it, my physicians on it. And that's a lot. And so there's only so much we can do to scale these digital solutions in their current format.
So in the process of sifting and choosing through all these, amazing solutions, and you're probably bombarded day after day with solutions, what are folks in roles like yours really looking for in a nutshell? If you could put it in one sentence, is it the holistic, easy flowing system?
Yeah. So first of all, I would tell you what I'm not looking for is everyone telling me their solution is going to change that disease state forever, because everyone tells me that. And I don't know if we have enough data to support that position. What I am looking for is more of the latter, which is, can we find a way to integrate these solutions into a meaningful platform where it doesn't mean I have to keep shopping for one-offs and my one-offs don't talk to each other and communicate. And therefore, my picture of the patient is actually walled off in some respects. And by the way, the experience of the patient is so fundamentally different on each of your services and devices and digital capabilities that I'm creating schizophrenic moments for them. And I don't think that's healthy. So imagine if you had to switch between Microsoft, Windows, and DOS and Apple every single day.
I heard you mention in an interview a very successful formula for a digital implementation. You used Higi as an example. Tell us more about that.
Again, I don't know if it's a formula, because you could probably apply a formula to other situations. But I think it goes back to a bit of what we talked about earlier. One is, I do think you need to co-create that vision with other people and bring clinicians into it sooner than later. We also were very specific on what we were trying to achieve and making sure people understood the upside of what this could do. Now, I'm going to give a little twist in that story, because since then we've actually, taken on some more risk-based contracts. And one of the things about risk-based contracts is that clinicians have to be armed with the toolkit to successfully engage those contracts. And I think what we've been able to show them is that these tools help arm them with those capabilities to enter these risk-bearing arrangements and have some success with them. So I just think that's a side component that, we'll see where that plays out more later. The other component I think we had is we had the ability to look at an omni-channel platform with Higi. And so what we talk about is we're not rolling out a product, we're rolling out a platform. And from that platform, we can launch a bunch of other solutions down the road. But this is where we're going to start. And this is how we're going to get people bought in and committed. And so for us, I think, again, retrospectively looking at it, the three things is making sure we have commitment and shared vision, making sure we understand the problem extremely well that we're solving and how that tools are going to help solve that problem. And then third, how is this going to enhance the clinician's life and the patient/consumer's life and outcomes as well? And for us, those seem to be working, and we keep providing feedback and updates on how it's going. We just got our most recent data back. And on this cohort, we showed about a 12% drop in overall blood pressure readings for those on the format. I don't know if we released the weight yet, but I think we saw about an 8.9 pound weight loss in this population. and we had over 60% of people who were in stable glucose and blood pressure readings move into stable ranges. And so if I'm an insurer or an employer and I can prevent somebody moving from that pre-diabetes into diabetes condition, I'm going to save over the lifetime of that person about 9x on their healthcare costs. And so again, I think painting this picture about why we do this, and that is where digital enhances what the clinician can do, right? It's not replacing them, it's enhancing them. And I think that's really what we've been able to get people bought in on.
We're going to move on to a fun game now, Roger. It's time for you to place your digital bets. So I'm going to be naming a technology in healthcare, and you're going to tell me if it's bullish or bearish, in your opinion.
Okay. All right.
And if you have an interesting opinion, you could also tell us why. Sure. So are you ready?
Sure.
Number 1, telehealth.
I'm going to give a thumbs up.
Thumbs up.
Yeah.
Number 2, wearables.
Thumbs up.
Thumbs up. Number 3, conversational AI.
Thumbs down.
Ooh, tell us why.
It has to be good. And there's a lot out there claiming to do what they actually can't do yet. And so until that gets sorted out, there's an absolute role for it. And I believe that will eventually become what it needs to be. But there's too many horror stories and clinicians worrying about what's being said and communicated back and forth for tremendous adoption at this point in time. It will get there. No doubt about it. It will get there. And I think you're going to have incredible outcomes with it. So when I say down, I'm saying more, I'm talking the next year or so, right? I'm not saying ultimately it's not where it ends up, but I think there's a lot of reasons that will be successful. They have to remember every time you start putting AI in as a conversational topic, it's also another threat that has to be overcome from the emotional and psychological perspective of a clinician. And that's, I think, part of those things that aren't really appreciated, even if the tech is great. My comment is not about the capabilities of AI whatsoever. It's about how it's going to be utilized and adopted. And frankly, I look at all the regulatory potential concerns with it and all those things more than anything else.
Makes sense.
So, but I think AI, yes. Now, I would also say everybody comes to me and says they have AI. And I'm really questioning if we are defining AI the same way. And I think has to be a little bit, not to sound rude, it reminds me a little bit of the .com in the early 2000s where everyone's a .com. But should everything be a .com? Should everything be an AI? So I think there's some weeding that needs to go on in that. But I think the upside and the potential of it is extremely exciting. I was just reading this morning an article that, they were able to find the fifth state of matter and, in some quantum physics and how that's going to affect quantum computing. And, to me, that's massive. Now, those are years away. But once we start getting to that, we're talking about game-changing things that I have a really strong excitement level for.
We shall see when we have you on here in 10 years from now. Okay. Number 4, Roger, is remote patient monitoring. I know you have a lot to say about that.
Huge upside.
2 thumbs up.
2 thumbs up. Yeah, I'm Roger Ebert and Gene Siskel. I would say for me, this is where it augments the clinician, right? When they come in and we get a blood pressure reading in the office for their visit, that's a point in time that I don't know what went on last night, what's on their mind today, what's going on, what they just do. Did they get 30 minutes of rest before we took that blood pressure monitor? And so if I can look at data and again, going back to basic statistics, more data is a more accurate picture. And RPM allows us to get more data so we can have a more accurate picture. With a more accurate picture, we can deliver more accurate care. We can deliver more accurate preventative care. We can deliver more accurate social support. So without that, I'm getting 12 minutes with that person annually in my office. So I'm a huge believer in RPM. And I think that where it needs to go, it needs to be more sophisticated, it needs to be easier to use. But the ultimate upside for it, I think, is where we need to be.
And last one is augmented reality.
I'm going to give it a thumbs up. And the reason I'm going to give that a thumbs up is I think that there's a lot. So my background is as a neuropsychologist. And one of the things that I look at is, can the brain decipher between reality and virtual reality? And the reality is probably not. And so there's a lot of good things I think that can come out of that. versus patient education, clinician education, training, social connections and support. So I think there's a ton of upside that can be on there. And I think it's non-threatening. And I put that up there, and people think, well, why do you keep talking about threatening or not threatening? Because ultimately, if the technology is awesome like AI, but it threatens the clinician, its utilization is not going to work. And so we've got to make sure that utilization is a part of what gets implemented. And I think, virtual, and that is one of the ways that we can do that in a non-threatening way. So I'm actually thumbs up on all. My bigger concern with AI is what we talked about, the compliance issues, the threat issues, all those stuff. And I think in our country right now, in the United States, there's a lot of paranoia around who people are communicating with to begin with because of bots and everything else. So there's a little bit of this skepticism around some of these things.
Tell me in a few words why you believe the U.S. healthcare model is failing at the moment.
Oh, gosh, this could be a long dissertation.
We'll do our own episode on that as well. But in a nutshell?
I'll say greed. I think there's a lot of greedy people in healthcare and a lot of organizations who claim to be there for the community's benefit, but are really not. We put a lot of money into new towers at hospitals, but where we really need the money is in supplying fresh and healthy foods to the community and helping people with mental health issues and supplying people real opportunities for jobs and financial attainment. And if we started investing in those things, I don't think we would have as many issues with diabetes, or we would have as many people having heart failure. There's a bunch of things that we can do. And that's why I keep saying, are we really medical systems or health systems? We're really medical systems, right? But not really health systems. And we have to start making that distinction in the country because we're getting jacked right now, right? Small employers, large employers, one of their biggest business problems is the cost of healthcare. And how can the United States of America not figure this one out? Yet we can pay CEOs of insurance plans and health system CEOs tens of millions of dollars to basically not show any improvement in access, not any improvement in quality, not any increased wellness of the population, a decrease in life expectancy. And yet we continue to go up 5, 6, 7, 10% annually on their costs. Someone's getting played here, and it's not the healthcare administrators, and it's not the insurance company administrators. It's the general public. It's the individual. It's the entrepreneur. It's the gig economy worker, and it is corporate America. And so I think we need to wise up, and people have to stop complaining about the gas going up $1 and start realizing their health insurance premiums have probably gone up 100% in the last 10 years. And that's not sustainable for the U.S. economy.
Wow. I think you're in a perfect place to somehow create waves in the space as CDO for a better 2023 and onwards in healthcare. Looking down to the future, how would you like to see the healthcare industry shaping itself up next year and beyond? What is one thing you would totally wish to see?
Well, I'd like to see, that's a huge question. I'm going to start with hospitals. I'd like to see them stop being the center of the universe for healthcare. Let's face it, if you have a large enough population, your hospital should be able to make money because people are born, people get sick, and people die. And it has nothing to do with the function of the quality of your organization or your marketing capabilities. People are injured, people have accidents, people get sick, and they need care. We need to start looking at how do we create standardized pricing for all procedures. I'm tired of hearing how complex healthcare is. You know what's really complex is making a refrigerator in China with 700 different parts, shipping it into a different port, and then getting it over and saying the same price is going to be charged in Saskatchewan, Canada, as it is in New York City or in Topeka, Kansas. That's really complex, but yet it's done. So I'm a little tired of the excuses that are being made and the games that are being played. And I think we need to be realistic that if healthcare wants to be really honest with itself, it needs to be there for the community. And it needs to get people on the boards who represent the community, not the bankers and the builders who are benefiting from being on their boards and then putting the healthcare administrators on their boards as well. And we're creating a very, very conflictual environment for all. We just need to be honest and start calling things out. Healthcare shouldn't be something that's politicized. Healthcare shouldn't be something that is only for the few and, the wealthy. Healthcare should be for everyone. And when we have better healthcare, and people are more physically fit, more mentally fit, employers benefit, society benefits, schools benefit. There is no downside to having a healthy population, none. And yet that's not what these health systems are in the business of. They're in the business of getting as much illness into their doors as absolutely possible. They don't spend time on preventative care. They don't have the ability to go on and say, if we keep the population healthy, here's our upside. So I'd like to see more value-based contracts that are real. I would like to see standardization of pricing. And I would like to see different. I think the people who lead health systems need to not be in healthcare forever. We need people from the outside to come in to fix what the people who have built the system have really built in a way that they can't unbuild because they're too motivated by its current infrastructure.
Profits over patients rather than patients over profits.
Yeah. I mean, a community hospital back in the 70s, 60s, 70s, in late to the 80s was a honorable middle-class role to lead that. Now we have made them Fortune 500 level CEOs who seem to think that they're doing something important when they may not even understand how to diagnose a cold or a cough appropriately. And yet our doctors and nurses are being burdened with more, compensated with less. And yet we're seeing people pay for unnecessary consulting to these hospitals. We're seeing them take expensive and lavish trips to the Ritz-Carlton and other places that they go. And it's all on the community's dime. That's all the community's dollars. That's not their money. Those are the community's dollars. And we have to get back to some of that and realize that if they want to be for-profit, then call yourself a for-profit, give your taxes back to the community. But until you do that, you can't have your cake and eat it too.
Well said. I want to thank you so much for all of your insights. I do want to know who are a few folks that you view as trailblazers to join us on our future episodes.
Yeah, so I think two people who I'm always impressed with what they're doing. One, I have to say the CEO of Higi, who is Jeff Bennett. Jeff is probably one of the guys who's thinking about the future of healthcare in a way that I don't think many CEOs are. And I think he's amazing. The other is somebody who I've always had a lot of respect for and did a lot of work with when he was at Providence, but now has gone back to Amazon, and that's Aaron Martin. I think Aaron's great. And, he's somebody who I think both of them are thinking differently about where healthcare is going. And then maybe the other one that I would put on there is Bill Goodwin from Walmart.
Well, Roger, I want to thank you again really for your time. You're doing amazing things. Keep it up. We'd love to have you back in a brighter future as well. And thank you so much for our audience for tuning in. How can we find you, our audience, if they have any questions? LinkedIn, I assume.
My email is pretty easy. It's jansenr@msu.edu. And Jansen's Jansen. And R is R. So, I look forward to connecting with anyone and who is in agreement or disagreement. I think that level of discourse and that is the way we get to what ultimately is best.
Thank you for listening to Patient Journey Pioneers, brought to you by Hiro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.